Once again, a very good afternoon to all of you. On the behalf of Human Biological Institute, I, Santosh Kumar Das, wholeheartedly welcome all of you to today's live talk on Fearless Against Rabies. Yesterday, we have observed 6 July, that is World Zoonosis Day. We have observed World Zoonosis Day to commemorate this great achievement of Sir Louis Pasteur and also to raise the awareness about the risk of zoonotic diseases and its prevention. Today, yet again, we will try our best to share facts about rabies and dispel various myths and misconceptions on rabies. Now, before we enter into the live talk session with our speaker, I would like to share a brief about Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited with a vision of shaping global healthcare by spearheading the One Health initiative. IIL was established by the National Dairy Development Board (NDDB) in the year 1982 as its unit, later registered as a company in 1999 with the name of Indian Immunologicals Limited. HBI, Human Biological Institute, was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out the first varicose culture rabies vaccine in the year 2000. Subsequently, Human Biological Institute (HBI) launched other vaccines, and currently HBI is one of the major players in human vaccine segment. HBI is leader in anti-rabies vaccine segment and present in around 50 countries. H- with three state-of-the-art manufacturing facilities, one is at Ooty, Gachibowli, and Karkapatla. HBI has also forayed into the market of clinically proven wellness products and infertility range of hormones. With the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, HBI believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customer needs. We are really proud of our Go Green initiative. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons of plastic per annum by introducing the eco-friendly pack of anti-rabies vaccine, that is Abhara. Indian Immunologicals Limited is known for its corporate social responsibility and such initiatives like adoption of government school. IL has adopted two government schools in the vicinity of Karkapatla facility and completely revamped the structure of the government school and giving facilities like midday meals program, classes, and entirely the government setup has been modernized. With this, with this intervention, the strength of the government school has increased over the years. One other initiative is Gift a Meal program in the coordination with National Dairy Development Board. Over 1,600 school-going children from Telangana and Tamil Nadu are benefited out of it. IL has also donated oxygen generation plant to Telangana Medical Science, Telangana Institute of Medical Sciences, Gachibowli. During this COVID period, this has a great help to the community. Human Biological Institute, we can meet. You can go online and get the details at www.indimmune.com and reach us at 1800 We're also available with various social media initiatives in LinkedIn, YouTube, Facebook, and Twitter and Instagram. So today we have an exclusive session on myths and facts on rabies. We have an experienced practitioner from Raipur, Dr. Vikas Agarwal. It is my pleasure, and I take this honor to welcome Dr. Vikas Agarwal to the live session today. Dr. Vikas Agarwal is a practicing physician, family physician for the last 20 years in Raipur. Currently, he is the president of Indian Medical Association Raipur. He has presented many sessions on animal bites and rabies vaccinations during state conference of rabies in Raipur. So, welcome Dr. Vikas to the session.
Namaskar.
Welcome. So, Doctor, today we are here to dispel many myths, and the first thing what we would like to understand, Doctor, one of the biggest myth of rabies is usually caught from the wild animals, that is foxes or bats. Is that true, Doctor, that only these animals, wild animals, carries the virulent virus of the rabies?
No, actually, 95% of the animal bites are which cause rabies are caused by due to dog bite. It is true that wild animals like mongoose, foxes, monkeys, they also can cause the rabies, but the 95% causes are cases are due to dog bite, which may be a pet dog or unvaccinated pet dog or street dog.
Right.
And
So that means, doctor, through whether a vaccinated dog can transmit rabies.
Yes, it can transmit rabies because the vaccine which are given to the animals or dogs are not 100% preventive. That's why there is chance that a person who has been bitten by the dog can get rabies. So we have to prevent and we have to take the immunization, even if
So
the dog is vaccinated.
great. I think that you have cleared certain myths on this, because most of the people, they don't take vaccine even after a pet dog bite. They feel that yet it's a pet dog or a pet puppy, they may not carry the rabies virus, but by doing so, people are taking risk. Is it so, doctor?
Yes.
Yes. So thank you so much. Then the next thing which would like to understand from you, doctor, can rabies be cured?
No, once the rabies has developed, it cannot be cured. It is 100% fatal disease. The only way to get rid of the disease is whenever any animal, particularly dog, monkey, which are very common in the city or village areas, or foxes, anything, person should go to the medical center and get immunized or get vaccine, which are immunoglobulins and anti-rabies vaccines, as soon as possible. That is the only way which can prevent the disease from developing. Once the symptoms and signs of disease have developed, we cannot do anything.
So that means there is no cure to rabies as of now in any part of the world.
No.
So we have to take necessary precautions.
Yes.
The next thing, doctor, would like to understand from you is that uh, can we, by looking at the animal or looking at the behavior of the animal, can you predict that whether the animal is having a rabies virus or not, carrying the rabies virus or not?
Not always, but sometimes if we look at the animal carefully, if its behavior has changed suddenly, either it has become lethargic or has become unduly violent, we can predict that there is something wrong, and we should be cautious at that time.
Uh, okay, so behavior of the animal, like the animal is salivating or drooling more, then whether the animal is ferocious or attacking, then based on that, we can predict the animal is rabid or not. But
Yes, and if the animal has become lethargic or not eating anything and barking at the any one person, even in the on the family members, then it's uh, it's a sign that probably there is something wrong with the animal.
is it like that? Suppose nothing happened, the animal is not showing any behavior. Is it
This
like
is
that? Any
this
behavior?
this is possible because symptoms take some times to develop. Suppose any animal develops rabies, it may take 3 to 4 days to develop the sign. If it is the first day of the bite, it is not necessary that animal may have any sign or symptom. So the we should take the first day of bite as the red signal that we have to take the immunization as soon as possible within 48 hours. And if it is on the face and above the neck or on the genital area or hands and foot, that is category 3 bite, that develops very rapidly. So if possible within few hours or within 24 hours, the person who has been bitten should start the immunization. It should not wait for the development of signs and symptoms in the animal.
Am I audible, doctor? Are you
Yes,
connected? Yes.
yes, yes.
Yes. So, thank you so much for clearing this fact that only by looking at the behavior of the animal, we cannot really predict the animal is having rabies virus or not. Now, uh, is it like uh, only through a bite the virus can enter to our body and infect us, or like rabies is transmitted only through bites of the animal?
No, actually, the saliva of the animal is infected with the virus. So, anywhere on the body, if suppose the animal has not bitten, but if there is some scratch on our own body and it has got infiltrated with that saliva, then saliva is containing the virus. So, even if there is no bite, but our scratched wound is infected, it has been infiltrated with the saliva, that is uh, sufficient for infiltration of the virus in our body, and it can cause rabies. So if there is leaking of the scratched area of body, we should get vaccinated as soon as possible. And the second thing, in some areas, particularly in caves, some aerosol, through aerosol the rabies can develop by the bat. Bat can produce rabies by through aerosol transmission.
So you mean to say if you see a bat inside a cave
Yeah,
or some closed room,
yeah.
people should be taking precautions for vaccination and visit a doctor.
They should take care, either they should go away from that side, or uh, they should cover their nose so
Yes.
that that infected air may not go inside. And if there is large number of bats in that particular area, it is better that a person should get vaccinated.
Okay. Now, doctor, as you said, we'll having having a scratch, even a scratch, that means a breach of the skin can be also very uh, risky at times. So
Yes.
yes, and leaks on the mouths or the near to the eyes and ears. So eyes and the mouth to the human being, because it is again called as category 3 exposure, probably by WHO, or
Yes.
mucous membrane is being exposed. So then, is rabies is not life threatening, because uh, most of the people, they feel that once bite and scratch, they don't consult a doctor, or they feel that faith healers are there, we can go to them, or take a tetanus toxoid injection and we are out of rabies. Is it like that rabies is not life threatening for humans?
Rabies, once it develops, it 100% fatal. So this is wrong that rabies is not life threatening. It is fatal once it develops. Nothing can be done after development of rabies disease. So it is better to prevent it as soon as possible.
Yeah, sure. Thank you for this. And one more, doctor, what we are want to discuss here is something about the fast aid, where fast aid, most of the people, they feel that there is no need. If you wash the wound further, or there will be further deterioration to the, we are further harming us by washing of the wound, application of soap and all. So, what kind of first aid measures people should take after an exposure to the animal bite?
Once the animal has bitten, that particular wound should be washed with copious amount of water continuously for 15 to 30 minutes with the help of soap, anything, that is bathing soap or detergent soap, anything. There should be, hello.
Yes, yes.
The Wound should be washed copious amount of water. That is the most important thing, and that too for 15 to 30 minutes, 15 to 20 minutes, again and again and again. So it will wash, the soap will wash out the virus, because that virus is fat soluble virus, and that will go away with the soap. But still there may be some amount of virus remaining in the wound. For that we have to use antiseptics also to prevent the secondary infection. We have to apply any antiseptic which we are having, idle Dettol or Savlon or povidone iodine, anything. And then the person should go to the doctor or nearby medical center to get the vaccines as soon as possible. It will be within 24 to 48 hours.
Many places people have a practice of, after washing also they have a practice of uh, applying turmeric, chili powder, bitter leaf paste, then some extracts of the plants juices. So how this kind of uh, application hampers the treatment, being a practitioner?
This will only deteriorate the wound, and it will help the virus to even uh, invade the body more rapidly. Even some people, they apply acids on the wound, that will also deepen the wound. It will send the virus on the in the deeper tissues. As soon as possible the virus enters the nerve tissue, nothing can be done. So it is better that nothing else should be applied over the wound. Otherwise, there is chance that rabies may develop more rapidly, or it may cause more secondary infection. So there
Right.
is no use of applying chili acids, any plant extracts, or any other chemicals. It will only deteriorate the wound.
Right. So yes, so that's what we wanted to understand from you, doctor, because many people apply turmeric and this chili powder, and you thanks for breaking the myth here. This needs to be really seen seriously, because we need to do proper first aid at home and visit a doctor immediately after an animal bite, because
Yes.
it could be fatal. That's what we should not take a chance with our life. Then coming to the next one, doctor, what we have wanted is, like, yes, we have already discussed that vaccinated dog, uh, we did not take a vaccine. That is another myth. So even if it is a puppy bite, it's a small puppy. So do you recommend rabies vaccination?
Yes, even if it is a small puppy, even 4-month-old puppy has produced the rabies in the world literature. So 4 month age of puppy, because there is virus is present in the saliva, not in the teeth. So it's not necessary that puppy is not having teeth. That's why it cannot produce rabies. It is a myth, because virus is present in the saliva, and once the wound gets infected with the saliva, this will produce rabies. So even if it is a puppy or a vaccinated dog, person should start vaccination and look at the animal for at least 10 days. If animal is alive for 10 days, then what is the dosing schedule is, first is a 0 day, then third day, then seventh day. Fourth dose comes on the 14th day. If the animal is alive even after 10th day, then 14th day dose can be omitted. But in that case, person has to take 28th day dose. That is the fifth dose. So person may omit the fourth dose. This will act as a prophylactic dose for the person. It will protect the person for whole life. Even if a person gets bitten by any rabid dog also in the later part of the life, he can take only 2 doses, and this will protect him.
I think it was quite a large amount of information, Doctor. It's so detailedly you have explained about this vaccination of pet animals and re-exposure cases. That is one of the important aspect what we have discussed now.
Yeah.
So in case of re-exposure, if you have taken a complete course of 5 doses, definitely later on if you are getting exposed, so we require only 2 doses. So thanks for sharing that information, Doctor, with our viewers. Now, doctor, would like to know something more about rabies. So, would you like to share some more information?
I have few slides. If you can share that,
Yes.
this will be more helpful. What is the dosing schedule?
So, just We'll share the slides. Just a second.
You come on the ninth slide,
Yes.
slide number 9.
Is it visible to you, doctor?
No, it is not visible to me.
Just a second.
Yes, please come on the ninth slide.
Okay.
The, this
Yes.
one. Eight. Before
Yes.
that,
Is it
before.
right? Okay.
No, after that.
This one, rabid
Yes,
animal
yes,
bite.
yes, yes. So, in any case of animal bite, the foremost importance is the psychological assurance to the person that nothing will happen if you take the whole treatment. On the basis of the wound, we divide it in three categories: category 1, category 2, and category 3. If the skin has been licked by the animal, it is category 1. The category 2 is only superficial scratch or nibbling, that too only single wound. And category 3 is more than scratch if the wound is on head and neck, face, genitalia, or hands or feet. In all these cases, we have to take the vaccination. Particularly in category 3 vaccine, the person has to go under anti-rabies vaccination and immunoglobulin. In category 2, preferably we should use immunoglobulin and ARV. In category 1, we can use only ARV. No need of immunoglobulin.
Okay.
Next slide. So after exposure, these are some precautions which are to be taken. Many doctors give in anti-rabies vaccine in gluteal area. That is,
I think, doctor, you have said you have you have pointed out a very important aspect what we have observed across India.
yeah,
We have seen certain doctors or certain people giving vaccines at the gluteal region. So,
yes.
thanks for sharing this, doctor.
This is very wrong practice. It will not give any immunogenic spike. It will not give any immunogenic action because vaccine gets erratically absorbed from that gluteal side due to large amount of fat. So this vaccine should be given only in the either anterolateral part of thigh or in the deltoid area. Steroid should never be used because it will reduce the immunogenicity. If person is taking steroid for few other disease, then the first dose of anti-rabies vaccine should be doubled. This is very important. There is no contraindication for post-exposure vaccination, even if the patient is pregnant or lactating or taking any other medicine. And most important is anti-rabies vaccine and immunoglobulin that should be given on separate sites, not together, because immunoglobulin will reduce the effect of anti-rabies vaccine. Next. So these are the vaccine schedules, immunoglobulin, sorry, anti-rabies vaccine schedules. There are two schedules, intramuscular and intradermal. The intramuscular schedule is 0.5, 0.5 ml or 1 ml, depending on the brand which we are using. On first dose is given on 0 day, the day when the person comes to the doctor. Then day 3, day 7, day 20, day 14, and day 28. These are 5 doses, and this should be given in the deltoid region in the adult and anterolateral aspect of thigh in the children. If we are using intradermal dose, then it is 0, 3, 7, and 28, and this is zero point 0.1 ml dose. Two doses are given in one in each arm. Means on 0 day 2 doses, third day two doses, seventh day 2 doses, and 28th day 2 doses. This vial can be used for 6 hours for at 2 to 8 degrees centigrade. Uh, this is particularly useful when many persons come for the treatment and bitten by same animal. So this will reduce the cost of the treatment also, because once the vial is open, it people on the same time, but for not for the same person for multiple times, that we use some dose and keep it in the fridge. Never. Once opened, it has to be discarded after 6 hours. And for immunocompromised or delayed vaccination, or if patient is taking anti-malarial, intradermal dose should not be used, only intramuscular has to be given. This is to be remembered, that in case patient is having AIDS or taking any chemotherapy for cancer, or vaccination is delayed, or taking anti-malarial, particularly chloroquine, only intramuscular route has to be used. Next, these are the sites you can see, uh, deltoid for adults. Next, and this is anterolateral part of the thigh for children. These are the sites for anti-rabies vaccine. Next, this is the way intramuscular is given. This is intramuscular. This is intradermal. One bleb is formed when we give intradermal vaccine. This was about anti-rabies vaccine, which we are using either Abhera or anything else. If patient is having category 2 or category 3 bite, particularly in immunocompromised persons, we have to use rabies immunoglobulin also, and it should be given with the first dose of anti-rabies vaccine. This has to be remembered, and after 7th day, it has no use. So either on first day, or on third day, or on 7th day, or if we are using in between, either second day or fifth day or sixth day, we have to give simultaneously anti-rabies vaccine also, and we have to continue the anti-rabies vaccine schedule which has been prescribed on first day. This has to be remembered. But after 7 days, because the anti-rabies vaccine starts producing antibodies, so there is no use of giving immunoglobulin. It will suppress the effect of anti-rabies vaccine. So it has to be used within first 7 days, not after 7 days. The dosing schedule is, if we are using human rabies immunoglobulin, this has to be used in the dose of 20 units per kg body weight. The maximum dose which has to be used 1500 international units. If it is equine RIG, it has to be used in dose of 40 international units per kg body weight, and maximum dose is 3000 international units. Even if the patient is 100 kg weight, he has to be given only 3000, not 4000. And if we are using new immunoglobulin, that is human monoclonal antibody, it has to be used in the dose of 3.33 international units per kg body weight, and this has no dose limit as per weight. We have to use as per weight. If patient is 100 kg, we have to give 333 333 units of immunoglobulin. Next. This is the way, by using insulin syringe, we can infiltrate the immunoglobulin inside the wound and around the wound. And if the wound is very large, we have to dilute the immunoglobulin in normal saline. And one thing more important, if there is large wound, it should we should avoid suturing the wound, because it will open new portal for the virus entry inside the body. And if it is very large wound, we should uh, do only very light suturing, not tight. These should be very loose sutures, and then that wound site should be well infiltrated with the immunoglobulin.
So, doctor, we do recommend tetanus prophylaxis. Why do we recommend tetanus prophylaxis for the patient?
That is a common practice, because in any open wound in the skin, there is always chances of tetanus toxoid, because tetanus toxoid, that bacteria is present in the oral cavity, and it can go inside the body. It can produce tetanus. That's why tetanus prophylaxis is very important in any wound, either by the animal bite or by any roadside accident or any needle prick even. Then we have to get tetanus any breach of the skin needs the tetanus prophylaxis. This has to be remembered.
Okay.
And if the person has been vaccinated, that is called pre-exposure prophylaxis. If patient has taken either previously vaccinated, and document should be available, not only oral. Patient is saying that yes, I have taken. You have to see on which date he has taken. Never क्या बोलते हैं उसको, कभी उस पर don't rely on the patient's oral documentation. Take paper documentation. If
Right.
the patient has taken tetanus prophylaxis, if the patient has taken the pre-exposure prophylaxis within last 3 months, only wound care, that is washing of the wound and the application of antiseptics and tetanus prophylaxis. This much is important. This much is sufficient. And after 3 months, any time in the life, if the person has taken pre-exposure prophylaxis vaccine, anti-rabies vaccine, he has to take only 2 doses of vaccine on 0 day and third day. And rabies immunoglobulin is not required if patient has received ARV previously.
Yes.
Uh, if there is continuous exposure to animals, particularly if there is any veterinary doctor or veterinary lab technicians or people who are exposed to animals continuously or who are keeping pet dog in the house, they should get the vaccines. The anti-rabies vaccine should be taken on 0 day, 7th day, and third dose can be given on either 21st day or 28th day. Dose is same 0.5 ml or 1 ml depending on the brand in the deltoid region, and in the if we are using intradermal, same 0.1 ml any single arm.
Okay.
Remember, in post exposure prophylaxis, we were using zero point 0.1 ml in both arms, but for pre prophylaxis we are using zero point 0.1 ml in any single arm.
Right.
And the booster dose is given, it is very protective, only when we have to take on 90th day. That can be taken if antibody titer goes below zero point 0.5 international units per ml. After taking 3 doses, 0, 7, 21 or 28, if we take our blood sample done and if the titer is below zero point 0.5 international units per ml, then we have to take single booster dose. That will complete the pre-exposure prophylaxis and protect the person from rabies lifelong, even if he takes only 2 doses of ARV after bite, and no immunoglobulin is needed in that case.
Right. So, doctor, the pre-exposure prophylaxis, can you just tell who are the high-risk groups in this? Who should actually consider taking pre-exposure prophylaxis?
The persons who are keeping animals in their house, who are handling animals continuously, either veterinary doctors or lab technicians handling veterinary labs, they should get pre-prophylaxis done.
Okay. Uh, I think doctor, lab technician, okay, but in recently WHO, World Health Organization, and Indian Academic of Pediatrics also suggested that children below 15 years of age should, or having pet at home, or going to school, they should consider. We should consider them vaccinating with pre-exposure vaccinations.
Not only children, what I said, if pet is there in the home,
Right.
person should get pre-prophylaxis vaccination done.
Okay.
Either it is adult or children, but
Yeah.
particularly for children it is more important because they are within the reach of the animal,
Yes.
so they get the bites more regularly and more severely. So their protection is more important, but it is equally important for adults as well.
So additionally, as a precaution, we should definitely see that if you take vaccine, pre-exposure vaccination, and future exposure happens, we are protected against accidental exposed to rabies. And we have a question, doctor, uh, from a viewer, and the question is, please tell me the different brands of rabies. Huh. Can we change the brand of rabies vaccination?
Preferably not, but if that particular bond which you have taken earlier is not available, we can interchange. But if it is available, we should not change.
Okay. So I think we had a very nice and elaborative session today. Thank you for being here with us, Dr. Vikas Agarwal from Raipur. Thank you
Thank
so
you.
much for joining here with the initiative that is Fearless Against Rabies. And we definitely look forward to see you again in some point of time for various other topics on rabies, because uh, the thing is that we have to educate and make awareness level on rabies more, so that we can save life. And in India, more than 20,000 people lose their life because of rabies. So being a citizen, this is our sole responsibility. Yeah, doctor would like to say. Yeah.
One thing is very important, particularly in village areas. Uh, any cow has been bitten by the dog, cow develops the disease, and many people who drink the milk of that cow.
Yes.
So it is important because rabies virus, although it spreads through the animal saliva, but it goes to all the body fluids, and milk is also a body fluid. So the persons who have taken the milk of that rabid cow after the bite of the animal, they should take prophylactic vaccination, post
Right.
exposure vaccination. That is very important.
Yeah. Yes, most of the people, where if the animal is rabid, and then as a precaution we should definitely take. Thank you so much, doctor, and definitely it was a very interesting session today. And with this, we are very much thankful to all the viewers to keep listening us on Fearless Against Rabies. Keep following us, Fearless Against Rabies. And thank you, Dr. Vikas, once again for being here with us today in the live session and dispelling various myths. And we have seen many facts being discussed today. Thank you so much,
Thank you.
Doctor, for being with us today. Thank you.
Thank you.